I'm going to be your student nurse today. Is that okay?
Yes.
Perfect. Can you please state your name and date of birth for me, please?
Brianna Camarena, March 3rd, 2005.
Perfect. And do you have any known allergies?
No.
All right, perfect. Today we're going to be doing a musculoskeletal assessment. So first I'm just going to kind of inspect and just look around. Okay, perfect. Now I'm going to feel for your temperature of skin. Perfect. Patient presents with no deformalities and patient is warm and dry. Now I'm going to palpate. So I'm going to start up here at your shoulders and just work my way down. Elbows, beautiful. And your hands, you use too. Okay, now we're going to do your lower, so your hips. Good. Any pain or tenderness?
No.
Okay, and can I have your feet, please? Any pain or tenderness?
No.
Perfect. Patient presents with no masses, tremors, or deformalities. There is no edema or swelling, and no pain or tenderness. Now I'm going to assess for your muscle strength. So I'm just going to place my arms out in front of you, and you're either going to push or pull them. So first I'm going to have you push my arms. Perfect. And pull. Beautiful. Okay. Now I'm going to have you push your legs for me. Good. Pull. Perfect. Patient's upper and lower extremities are graded a 5 out of 5. Okay, now we're going to do ranges of motion. So I'm just going to have you stand up and we're going to do them together. Okay, so first we're going to start with our fingers. Okay, so I'm going to have you flex your fingers, extend your fingers. Okay, perfect. Now I'm going to have you go back to a fist for me, please. Awesome. Back out. Now we're going to do radial. So you're going to try to bring your fingers in, not move your wrist. Beautiful. And then we're going to do ulnar. So try to go outward with your hands. Perfect. Okay. Now we're going to go to supination. Oh, that's for the wrist, but that's okay. Supination, pronation. Okay, perfect. And then I'm going to have you do your, we're going to do finger to finger. So you're just going to go like this and then go back for me, please. Perfect. Okay. Now we're going to do your wrist. So first I'm going to have you flex your wrist, extend your wrist, hyperextend your wrist. Perfect. Now I'm going to have you do ulnar, go out with your wrist. Perfect. Back forward. And then radial in. And then we're going to do supination and pronation. Awesome. Now I'm going to have you do your elbows. So we're going to flex and extend. Awesome. Now we're going to do shoulders. So first what I'm going to have you do is circumduction. So we're just going to kind of go back and then we're going to kind of go forward. Perfect. Okay, and then I'm going to have you do abduction. So we're going to bring them up towards the top and then adduction back to the body. Okay, beautiful. Now I'm going to have you flex your, perfect, and then extend back, hyperextend. Perfect. And then I'm going to have you do an external rotation and then internal back behind you. Beautiful. Okay, now we're going to do your hips. Okay, so for the hips, I'm going to have you flex them forward up for me. Perfect. And then back down. Okay, now, yeah, we can kind of turn. So go ahead and do flex. Okay, and then we're going to extend back down and then you're going to hyperextend behind you. Beautiful. Now we're going to do abduction out, adduction back. Perfect. Now I'm going to have you go back up to flexion and we're going to do internal rotation. So you're going to try to bring that in. Perfect. And then we're going to do external rotation. Okay, perfect. Now we're going to do the other leg. So we're going to do flexion, extension back down, and then hyperextend. Perfect. Now abduction, so away from your body. Perfect. Adduction back. Beautiful. Now I'm going to have you do internal rotation and then external rotation. Awesome. Now I'm going to have you, we're going to do your knees. And this is really easy. So I'm just going to have you flex your knee back and then extend. Perfect. And then same thing, flex, extend. Okay. Now we're going to do your ankles. So we're going to do dorsiflexion, so you're gonna bring your ankle up, and then plantar, so bring that front of your foot down, beautiful. And then we're gonna do inversion, so in, rotate in, and then eversion, rotate out. Okay, same thing on that other side for me. So up, perfect, plantar, awesome, and then inversion, and then eversion. Okay, now we're gonna do your toes. So you're gonna flex them in, perfect, and then you're gonna extend them out. Awesome. Now the other side, flex and extend. Beautiful. Client presents with full range of motion on the upper and lower extremities. Now we're going to assess for your range of motion of your spine. So first I'm gonna have you twist to the left and then twist to the right. Perfect. And then can you please just go back a little bit, and then we're gonna have you, and then I'm gonna have you bend over. And then now I'm going to assess for scoliosis. So I'm just gonna place my hands here. Is that okay?
Mm-hmm.
Okay, and I'm gonna start at the top. Perfect, and then I'm just gonna go down. Perfect, we have a good spine.
Yay.
Awesome, so client presents with full range of motion of the spine and no scoliosis is noted. Do you have any questions for me?
No.
Perfect, thank you so much for coming in today, and I hope you have a good rest of your day.
Thank you.